It's one thing to experience loss, but it's another to realize that the very system designed to support you has failed you, both as a nurse and as a patient. For Caitlin Miller, this reality was heartbreaking. She dedicated her life to caring for others, yet when she needed the system the most, it left her without the support and resources she desperately needed. If you missed part 1, I would encourage you to go back and listen to Caitlin's story and how she navigated 2 stillbirths. We're going to talk a little bit more about her second stillbirth and what that taught her, and then now how is she using this eye-opening experience that she had to pass through, which was so painful, to identify critical gaps in our healthcare system that she's now answering the call to fill. Thank you for joining me again on It's Your Story to Tell. I'm Megan, and I'm here with Caitlin. Caitlin, would you tell us a little bit more about your experience with this second stillbirth, which in some ways, when I heard it, I was even more appalled at the response and just the lack of sensitivity. But tell us about that, and then how you are making a difference in the services you provide as a nurse coach for moms who are walking through their own grief journey.
I did end up, after my first loss, I had 3 healthy baby boys. They're now 10, 7, and 4. And when my youngest son was 10 months old, I found out that I was pregnant, and I was still actively nursing my son, still pumping at work, and it wasn't a good time to have another baby. Let's just say that. Honestly, it wasn't planned, obviously, and I was not very excited about it in the beginning. And then we went to our first ultrasound, and they found another pocket of fluid behind the baby's neck. And at that point, I was already 14 weeks along. I was almost through my first trimester before I even realized I was pregnant, which I'm embarrassed to say. But I was just like, oh my gosh, like this can't be happening again. And so, but at that point, right away, the midwife was like, given your past experience, let's give you a teddy bear and we'll record the heartbeat for you now, just in case, whatever happens, you at least have that. So we did that, and, she said, unfortunately, looks like you have another Turner syndrome baby. And, after my first loss, I saw genetic counseling, and they said it's extremely unlikely that, this will happen a second time. They said there's like a 1 in a million chance that it would happen within 3 generations of the same family. And it's one of those like chromosomal abnormalities that there's nothing you can do to prevent it. It just happens. And most babies who are conceived with Turner syndrome are miscarried early on. I carried these 2 babies halfway through the pregnancy, but this time we knew there was something wrong earlier. So we had time to prepare. We were going to appointments every week. We were seeing pediatric cardiologists. She recommended we deliver the baby at CHOP should the baby survive through the rest of the pregnancy. And by CHOP, I mean Children's Hospital of Philadelphia. And so we were preparing to go there because we were going to do a consult and potentially see about having an intrauterine operation on the baby's heart, because the baby had a heart defect that wasn't compatible with life. And so we were preparing for that. I felt very guilty because I, wasn't happy about the pregnancy in the beginning, and I really struggled with that. I mean, it's still something I struggle with. I ended up having to quit my job because I was going to appointments so often, and my boss wasn't supportive, and I was up to my top of my head in stress, and I just didn't think I could take any more. I was working 50, 60 hours a week, and it was right around Christmas time, and I was trying to get ready for my kids, trying to deal with this pregnancy, wondering if the kick that I feel from my baby is going to be the last one, and just trying to process all that. And I ended up just quitting my job because I'm like, I can't handle any more stress. They're not supportive. Like, I need to be there for my kids and make their Christmas as normal as possible, and also focus on myself and my baby that I'm carrying, and, try to celebrate what small amount of time we have left with her. And so it was a few days before Christmas, then I went a long period of time without feeling any kicks. And I had a fetal Doppler that I kept in my house, and I couldn't pick up a heartbeat. And I called into the on-call provider. This was on a weekend, and it was the midwife that I know well, and she said, "Come right in, and we'll do an ultrasound and go from there." So I went in, did an ultrasound, and they confirmed that the baby had passed away. So the next day, I had to have an appointment at the clinic and to figure out what the next steps were. And the doctor that I saw, she walked in the room, didn't say sorry for your loss, just kind of said, "Well, I don't think we're going to be able to get you in before Christmas because it's the holidays and people are on vacation, and so I don't even know when we're going to be able to get you in, and we're probably going to have to cut you up and down to get this baby out." And I'm like, "What?" And I'm trying to process what she's saying, and I'm like, "Excuse me?" I said, "Christmas is 3 days from now. Like, you really expect me to go all that time carrying, you know, a deceased baby inside of me? That's, how cruel can you be?" And I said, "And why would you have to do a vertical incision when, like, I didn't understand any of this?" And she's like, "Well, you've had 3 C-sections, and we just don't want to risk rupturing the uterus. I just don't feel safe inducing labor." And I'm like, "Okay, but I never had a vertical incision C-section. It was all like the bikini incision." And
Mhm.
like, well, and it's like, "Well, if you want, I can call over to Danville. That's the bigger hospital, sister hospital. They have, maternal fetal medicine is there, and NICU." And I'm like, "Well, yes, I would love for you to do that, please." And she's like, "Well, I'll go ahead and send a message over." And I'm like, who knows when they're going to get this message? So we left that appointment, and I was just appalled and still trying to wrap my head around the lack of compassion. And it really took me back to my first loss, 8 years prior. And I'm like, how has nothing changed in 8 years? It just didn't make sense to me. So at this point, I had been connected with a palliative perinatal nurse, and she told me I can call her anytime. So I called her and told her what was going on, and she said, "Oh my goodness." She's like, "First of all, I'm so sorry for what you're going through. Second of all, that is completely inappropriate. You do not need to go all that time. Let me call my medical director and I'll call you back." She called the medical director. She called me right back, and she said, "Have your bags packed and be down here at our hospital by 8 p.m. and we'll induce you." I said, "Oh my gosh, thank you so much." So that's what we did. And, we got there, and it was obvious that, this hospital and maternal fetal medicine was much more equipped and more comfortable dealing with situations like that, because they were so much more supportive and compassionate. And I said, "Were you like, do you need to do a C-section?" I was told I would need a C-section. I would have to be a vertical incision. And he's like, "No." "Do you want a C-section?" I'm like, "No, I don't. If we can avoid surgery, please."
Mhm.
And he's like, "Okay, well, and do." And they did. And 6 or 9 hours later, I had the baby, and everything was uncomplicated. There was no rupture. Everything was fine. And we spent, as much time with the baby. And the hospital chaplain came and did a baptism, and, then we were discharged. But I, I was told my husband, like, "I just cannot believe that this doctor, this OBGYN, cruel to me." Her approach to that situation was very cruel. And I just thought, there just has to be a better way. Like, I know I'm not the only woman who has gone through
Mhm.
such a loss. And I'm sure I'm not the only one who has experienced that level of cruelty. So that's when I decided I enrolled in the nurse coaching program with the Nurse Coach Collective, and I got my board certification and my board certification in holistic nursing. And that's when I'm just like, I'm going to be a source of support for other women because I know it's needed. And so that's how I kind of ended up here. And my hope is that I'm hoping that my story can be an inspiration to other women, because it is very isolating, and a common theme that I'm hearing is there's just no validation. It's so isolating. Everybody experiences those comments, what they call, I guess, toxic positivity. It needs to be, perinatal loss is, according to one of the studies that I read, up to 25% of women who experience it have symptoms of complicated grief and PTSD. And it wasn't until the 1970s that it was even recognized as an emotional experience. So, and then I think about the 70s, I'm like, that's only 10 years before I was born. Like, that's crazy.
Mm-hmm.
And in a perfect world, every women's health clinic would have a nurse coach to help women through grief after a loss. So I work with women to build connections with other people, finding a support group of other people, who walk in your shoes is very validating and helpful, and can really help with some of the feelings of isolation, connecting with God. I know for me, after my first loss, I really felt this strong connection with God in a way that I never had before. And being out in nature connects me to God. And that also helps me connect with my babies, which is very healing for me. And then work on like whole body health, proper nourishment. We all know trauma and grief leads to chronic stress, which leads to breakdown and dysregulation of all your body systems. So really just working to regulate those things and rebuild that wellness within yourself, mind, body, and spirit.
Thank you so much for sharing your story and helping us to see the shortcomings in the system. We do it out of love because we want to see things be better as nurses, and seeing our patients' needs met from that holistic space is so powerful. I really appreciate your acknowledgement of how powerful it is to be in community with people who have had a shared story. And that is what It's Your Story to Tell is all about, is allowing people to hear other people's story to help them to not feel so alone, and also to be able to connect them so that they can have that support. Because I can walk through a story in domestic violence and addiction and things that were part of your story, but you have this very unique story that will be more effective in walking alongside someone, just like in medicine, where you've got your heart specialist and you have your lung specialist and your bone specialist. We forget that emotionally, these things look so different, and the way to approach them is going to be different based off of kind of those stories and the similarities. If there is somebody who is walking through loss, whether it is during your pregnancy or you lose a child at any point in your life, or someone you love and it's creating overwhelm, grief that you just, like you described, Caitlin, where you couldn't get out of bed and you're having suicidal ideation, whether you have a plan or not, your body and your mind is telling you that this is so much that you don't even have words or the skills necessarily to process and go through it, which we know if you don't process and move through it, you stay stuck. And so if you are in that place, I want to get you connected with Caitlin. We will have the information to connect with her in the show notes. And thank you, Caitlin, for taking your heart and working through it so that you can now use that. Because I know that was not an easy journey that you committed to. And now look at you, where you went from where you couldn't even speak to where you're now sharing your story on podcasts to be able to help others, it's really pretty miraculous. And I hope that inspires our listeners.
Yes, thank you so much for having me and giving me the platform to share my story. I really hope this, was inspiring for others. And, if anybody who's listening needs that same type of support that I needed, please reach out.
Thank you so much. Listeners, healing begins when we acknowledge the gaps of whether it's in the healthcare system or in our own life, and then we work together to fill them. Until next time, take care and know that your story matters. Please share this if you know someone who is going through something hard, loss, and great grief, so that maybe they can find resources that can help them. Thank you.